Why do some people snore so loudly? Snoring is the harsh or hoarse sound that occurs when air flows past relaxed tissues in your throat. This causes the tissues to vibrate as you breathe. Almost everyone snores from time to time, but it can be chronic for some people. At times it's an indication of a serious health condition. Symptoms: snoring is associated with a sleep disorder called obstructive sleep apnea. Not all people who snore have obstructive sleep apnea, but if the snoring also includes the following symptoms, you may need to see a doctor for further evaluation for obstructive sleep apnea: excess daytime sleepiness, difficult concentrating, morning headache, breathing pauses during sleep, sore throat upon awakening, restless sleep, gasping or choking at night, high blood pressure, chest pain at night, loud snoring. Obstructive sleep apnea is characterized by loud snoring followed by periods of silence when breathing stops or nearly stops. This reduction or pause in breathing may signal you to wake up, and you may awaken with a loud snort or gasping. This disruption of sleep may cause you to sleep lightly during the night. This pattern of breaking pauses may be repeated many times. People with obstructive sleep apnea experience periods when breathing slows or stops at least 5 times during every hour of sleep. Causes of snoring: a number of factors can cause snoring. Your mouth anatomy. Having a low, thick, soft palate can narrow your airway. Overweight people may have extra tissues in the back of their throats that may narrow their airways. If the triangular piece of tissue hanging from the soft palate, also known as uvula, is elongated, airflow can be obstructed and vibration increased. Nasal problems. Chronic nasal congestion or a crooked partition between your nostrils called deviated nasal septum may contribute to your snoring. Alcohol consumption. Too much alcohol consumption before bedtime can also cause snoring. Alcohol relaxes throat muscles and decreases your natural defenses against airway obstruction. Sleeping position. When you sleep on your back, the gravity effect on the throat narrows the airway. This causes loud and frequent snoring. Complications associated with snoring. You may be at risk of other complications, especially if your snoring is associated with obstructive sleep apnea. This include difficulty in concentrating, daytime sleepiness, frequent frustration or anger, a greater risk of high blood pressure, heart conditions and stroke, a risk of motor vehicle accident due to lack of sleep, an increased risk of behavior problems such as aggression or learning problems in children with obstructive sleep apnea. Diagnosis: the doctor will review your signs, symptoms and your medical history. A physical examination will also be performed. The doctor may also perform an imaging test such as an X-ray, a computerized tomography scan or magnetic resonance imaging. These tests check the structure of your airway for problems like deviated septum. Your doctor may also suggest sleep study. This may at times be done at home. However, depending on other medical and sleep symptoms, you may be requested to stay overnight at a sleep center to undergo an in-depth analysis of your breathing during sleep by a study called a polysomnography. In a polysomnography, you are connected to many sensors and observed overnight. The following information is recorded: blood oxygen level, brain waves, heart rate, breathing rate, sleep stages, eye and leg movement. Treatment: lifestyle and home remedies to prevent loud snoring. Sleep on your side. Laying on your back allows your tongue to fall backward into your throat. This narrows your airway and partially obstructing air flows. If you find that you always end up sleeping on your back in the middle of the night, try sewing a tennis ball at the back of your pajama top. Lose weight if you are overweight. Overweight people may have extra tissues in the throat that contribute to snoring. Raise the head of your bed to about 4 inches. Treat nasal congestion or obstruction. Deviated septum or allergies can limit airflow through the nose. This forces you to breathe through the mouth, increasing snoring. Avoid drinking alcoholic beverages at least 2 hours before bedtime. Sedatives and alcohol depress your central nervous system, causing excessive relaxation of muscles, including the tissues in your throat. If your snoring is accompanied by obstructive sleep apnea, the doctor may suggest oral appliances. These are form-fitting dental mouthpieces that help advance the position of your jaw, tongue and soft palate to keep your air passages open. Continuous positive airway pressure. This involves wearing a mask over your nose or mouth while you sleep. Upper airway surgery. These surgeries aim to open the upper airway and prevent significant narrowing of the airway during sleep.